you've been emphasizing the importance of proper physical distancing and masking and encouraging people to get outdoors, but that's not allowed for trick-or-treating. We're just trying to square this. How can people be allowed to gather on patios, eating and drinking? Neither of the food that's served on patios or the drinks are prepackaged, but kids can't walk with their parents outside in a full costume and have pieces of prepackaged candy fall into a bag.
Here, Helly, I hear you. But believe me, I don't want to be the bad guy out there that says kids can't go trick-or-treating. I don't want that. As I won't mention, but one of the mayors said, hey, at least I don't have to be the bad guy that has to cancel Halloween. You do. Like, I don't want to be doing that. Believe me. But when you have the kids going up and the groups may go up 4 or 5 and you're sticking your hand in the candy jar and then handing it over. A lot of times what we would do, we hand out the container and say, okay, kids, take what you want. They're sticking their hands in. I'm just following the health advice. I'm following the doc's advice. I'm following all the chief medical officer's advice locally. Toronto doesn't want it. Peel doesn't want it. York doesn't want it. Ottawa doesn't want it. What can I do? I can't go up there and say, okay, forget docs. I'm not listening to you. All the kids go out there and go door to door, stick your hands in those bags, and God willing, God forbid something happens. I just can't chance it. I'm not canceling Halloween. Let's just not go door to door in the hotspot areas, because those regions I counted up make up out of all the cases. The vast majority, I think it was 90% between those 4 regions, and the rest of the province, which is massive, is okay. But that's what I got to say about that. I feel terrible. I do. Just terrible about it.
I get you don't want to be the bad guy on Halloween. Yeah. Fully understand that. But we keep being told that you've got to be in close contact with someone for 10 to 15 minutes to contract COVID-19. Then you're effectively canceling Halloween. You're telling people not to go trick-or-treating. You said that you wouldn't close bars or restaurants without hard data in front of you. Mm-hmm. Whether it's Halloween or it's the bars and restaurants, neither you nor Dr. Williams has shown us the actual work that connects the transmission of COVID-19 to trick-or-treating or to bars and restaurants. So is your public policy being driven by fear, either from you and your cabinet ministers or from Dr. Williams or medical officers of health in respective communities? Because if it takes 10 to 15 minutes of close contact to contract COVID-19, how on earth do you get it from trick-or-treating door to door?
Okay, Brian, I'm no doc. Before I pass it over to him, what I'm taking that you may think it's all right for the kids to go out door to door, even if they go to seniors' homes or whatever. They stick their hand in the basket. Kids are sneezing, wiping their nose, doing everything, and out in the cold, and then they stick their hand in there and they pass it over. Brian, I'm just going by the health advice. That's what I'm doing, and I will always do that. And it's not based on fear. It's not based on my cabinet. It's based on the medical advice that I get, not just from Dr. Williams, the whole team. As Dr. Brown said, under each one of these docs, there's 70 other docs, and by the way, vast majority are all volunteering their time to give advice. So I have 2 choices. Either forget about the docs and ignore them, everyone just go hog wild and join the 4,000 maskers that went down in Dundas Square, and God knows what was spread down there. Or we take little precautions and we just be safe with each other. That's all we're doing. Don't cancel Halloween. Have fun. Do something else. That's all I'm saying.